after a little break, we went ahead and flipped our patient. We are still on our third case. We're doing that lipo 360. So if you're just coming back, earlier our patient was lying on their stomach. We had Dr. Boom Boom Pow and Dr. Bam doing some lipo around her back and her flanks while she was laying face down. Then we took a little bit of a break and we went ahead and flipped her over. So now we are doing lipo on her abdomen, her stomach, and around her sides. So we're just going to finish that up, and then we have one more case today. We have 4 cases total. So we have one last case that we'll go live for. So tune in for that. We will be showing everything. So on YouTube. We'll be here on TikTok, we'll be here on Instagram. So if you guys are interested to see our last case of the day, it is going to be like a super mommy makeover. You guys can join us, give us a follow, and it'll notify you the next time we go live. We are also live on our YouTube for this case. It's just lipo 360. So it's a pretty straightforward. Basically, Dr. Boom Boom Pow is just going in and removing unwanted fat around our patient's stomach area, around her back, just to give it a more slimmed look. Hey there, Alex, on our YouTube. How are you today? Again, we are on our third case of the day. This morning we had a breast augmentation. We had for our first case, and then our second case was a breast augmentation. We did a thigh lift. We did some lipo around her knees. We did a scar revision for from a surgery that she had prior. I'm not sure how long ago she had that surgery. I believe it was a tummy tuck. We did some revision on the sides where the end of the scar would be when we do a tummy tuck. So like closer to like the sides past her hip a little bit. We did that, and we also did a breast lift. Again, if you guys have any questions, comments, concerns, you guys can leave them here in the chat. We'll get back to y'all. I can answer them, somebody else can answer them, or we can ask one of our surgeons. And then again, we're gonna go live one last time for the day. And this one is just lipo 360. So we're just removing some fat from our patient's stomach area, her abdomen, and on her sides.
Yeah, it's not a lot of fat, man. No, when it's visceral, you can't really.
No, that's what
You can't go after that.
I'm saying.
I tell people too.
Just give it a second.
No problem.
So we'll be live here for a few minutes, and then we're gonna go and take a break, and then we'll come back and be live for our last case of the day. Right now we're just doing lipo 360 on our third patient of the day, and then our last case is gonna be a mommy makeover, so stay tuned for that. She's got a lot of procedures going on, so it's going to be a longer case. we were live earlier this morning for our 2 prior cases to this one. Again, we did a breast augmentation, so that's adding implants to our first patient of the day. Then for our second patient of the day, we did a thigh lift. We did some lipo around her knee area. We did some scar revision from a tummy tuck surgery that she got done a while back. And we also did breast augmentation as well. So we did some implants, and then we also did a lift.
100 lower abdomen. 100 lower.
Hope y'all are doing well today.
75 right flank. I'm gonna wake up. We'll be down here about 5.
Yeah.
Okay. So we'll be live here for a few more, and then we're gonna go take a break, and then we're gonna go live for our last case of the day. Again, it's gonna be a super mommy makeover, and we will be live on all platforms. So tune in for that. Give us a follow if you'd like to be notified when we do go live so you don't miss it. It'll be our last case of the day, but we will be live later this week. And if y'all are ready to take the next steps in booking your consultation and meeting one of our surgeons here and scheduling your surgery, you guys can fill out that form that I have pinned here on the bottom of our TikTok, or you can find it in our bio at that get a quote
50 upper,
button.
upper half.
Once you fill it out, somebody from our team will reach
Okay,
out
one
to
knee
you.
down.
Okay. They'll reach out to you, and then you'll be able to ask any questions. We'll be able to set up that consultation. We're going to be hopping off here, but definitely tune in for our last case of the day. Thank y'all for joining us.